Welcome to the Rotary Club of Beaumont, the 72nd club founded in the world. Today, our invocation is going to be led by Michael Wolf, partner, Wolf, Bunt and Associates. And our pledges are going to be led by Tim Sadella, president of American Valve and Hydrant. Michael.
Let us pray. Source of all being and guardian of life and liberty, may our nation always merit your protection. Teach us to give thanks for what we have by sharing it with those who are in need. Keep our eyes open to the wonders of creation and alert to the care of the earth. May we never be lazy in the work of peace and prosperity and honor, and let's honor those who have died in the defense of our ideals. Grant our leaders patience and wisdom. Help us all to appreciate one another and to respect the many ways that we serve you. May our homes be safe from affliction and strife, and our country be sound in body and spirit. And may the leadership of our community, state, and nation be guided by integrity and wisdom as we work together in your service, giving of our time and commitment to make the world a better place. And may our efforts bring fulfillment and joy and shine light where there is darkness. Amen.
Amen.
Good afternoon, everyone. I'd like to try something a little different today. So instead of everybody reciting the pledges, if you will just listen today as I recite it, you can either stand or remain sitting with your hand over your heart and reflect on the words of our pledges to our great nation and our great state. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. And now to our great state. Honor the Texas flag. I pledge allegiance to thee, Texas, one state under God, indivisible.
Liberty and justice for all.
Now, Sherry Pierce is going to update us on the wind down survey.
No, I don't have an update on the survey, but I just want to remind you to check and check your emails and reply to the survey, because we're going to be putting them all together sometimes after Friday and making a recommendation to the board at our board meeting next Tuesday about what we think we should do. We've got a couple of ideas, and if you have an idea, please feel free to include it in your survey, because we've had some pretty good things come in. One thing we're looking at is a possible kind of making it kind of like Rotary Goes Home, so we would have small groups. Somebody even suggested possibly a virtual thing where you pick up the wine, you get little bottles and you can do it. You can, go through and have somebody tell you about the wines and things. So we've got a lot of different ideas, and we just want to do something that's safe and fun and hopefully can raise a little money, but mainly we just want to continue our tradition of wind down and just kind of keep it in the works. And if you got any questions, you can contact me or Jackie or Cindy, or Kathleen is still involved, and I appreciate all of their help. But we're going to do something, all right?
Thank you, Sherry. Now to introduce our speaker, we have Dina Hughes, CEO of TAN Healthcare.
Dina, you need to
Unmute Dina.
Hello again. Sorry, guys. I have the absolute pleasure of introducing Ms. Ulmer, and I would have to agree with Ms. Poole that Sherry has become healthcare's best friend lately. So I'm so happy she's here. But Sherry is a native of Beaumont and a proud graduate of Hebert High School. And after obtaining her Bachelor's of Science in nursing from Texas Women's University in 1974, she began a career that has spanned 46 amazing years. For the last 8 years, she's served as the director of the City of Beaumont's Public Health Department, and for 12 years, she served as the health department's nurse manager. In her role as health director, she is responsible for the administration and budgetary oversight of all areas of the health department that include vital statistics, health promotions, environmental health, emergency preparedness, and other programs. Sherry and her husband of 42 years, Gerald, are members of Christian Faith Worship Center, where Sherry is a member of the Greeters Ministry. They have one daughter and one absolutely fantastic grandson,
Yes.
Sherry Ulmer.
Thank you so much, Dina. It's so special for me to be with you today, and it is especially special to be introduced by my friend and colleague, professional colleague, Dina Hughes. We do a lot of work together. So thank you. Thank you to the Rotary Club for inviting me to speak to you today. And of course, I spoke to council on yesterday, and one of the council members said that I was the expert in the room on COVID, and that is nowhere near the case. What we're finding out is COVID right now is changing day by day, and it is also the way that we're dealing with it sometimes changes minute to minute. So it has been a challenge for us to keep up. But with wonderful healthcare partners that the health department has an opportunity to work with on a daily basis, we are really, really working together. We're all in this together to hopefully see a difference in the spread of this infection. So I am going to try to get to the screen, Jackie.
Share screen at the bottom.
Share. I don't think this is where I need to be though.
Just scroll down a little bit on your picture. Scroll.
I see share, and then I need to go to.
There you go.
It's
You're
not there.
Just
Okay.
open your PowerPoint.
Okay. Yay.
You got it.
Got it. Okay, great. Okay, so I always like to start off with the mission statement of the health department. We do have a mission statement, and see, I need to move this over. So our mission statement, of course, is to promote healthy lifestyles and prevent diseases in our community and protect the health of our community. So prior to COVID, we are responsible actually for reporting and responding to diseases. We have a list of about 125 diseases that we receive from healthcare workers if a person or patient in the community tests positive. And some of the things on that list include tuberculosis. So when a person tests positive for TB, that report comes to us, we notify that patient, and then we do contact tracing, contact investigation. We find everybody that that patient has been involved with or has been around or who he lives with, all of his social circles. So we start from the closest contacts, household contacts, and it's a ring. Then we spread out to where does this person work? And then we spread out to a social circle. And we notify those persons, and we try to get those persons into the health department so that they can get tested. We put the patient who is positive on medications. That person is on medications for 6 months. And so for at least 3 weeks, the person has to come into the health department, or we take the medications to the person. We have to see the person take a certain number of doses before we repeat the blood work and determine that that patient is no longer infectious. So all of this is done behind the scenes, right? So we are the discipline that is accustomed to working behind the scenes. We don't have TB epidemics here because we deal with those initial cases as we get them. And then we have some of those contacts of those initial cases that need to be on preventive medication. So they may show antibodies to the TB, but they don't have an infectious disease. So what we do is put them on preventive medications, and they take that medication for 9 months. And hopefully they will never convert to an infectious process. So we like working behind the scenes. We don't get a lot of attention, but the work that we do is very serious. As COVID came on the scene in Southeast Texas, and we had our first case back around the middle of March, we have been thrown into a spotlight that everybody calls us. We get calls about everything. And so we are at a point where we're still learning about the disease just as the medical experts are. So in Beaumont, we do, initially, our cases were, we contact each person who tests positive. We determine the onset of their symptoms. We determine whether or not they have had any travel history. And initially, most of the people who were testing positive had travel history until we got one patient who absolutely had no travel history, and we still have not been able to determine where this person was exposed. We were not able to find out that he had been around anyone who had been sick, and from that point forward, the virus is now community spread. Of the 2,000 cases that we had, not yesterday, but the day before, that's when we did the PowerPoint, 2,237 cases. Most of the cases that we're getting now are community spread cases. Nobody is really traveling, so we're seeing that the cases are community spread, and they are community spread across all zip codes in Beaumont, and I'll be able to show you that in a few minutes. I don't know how well you can see this chart.
Sherry, excuse me, if you'll go up to slideshow.
Yes.
And then over on the left, you'll see from this, go ahead and click on that.
Slideshow?
Click on slideshow, yes.
Okay.
And then from the current slide on the left side, you'll see that icon.
Which icon?
From current slide.
US.
Go down below. Yes, over left, left, left.
Left, left, left.
You keep going.
Okay, okay.
Where it says from current slide.
Gotcha.
It'll make that just a little bit bigger.
Great. Okay. Yay. That might be a little bit better. Is that better?
Actually, it went a little smaller.
He can click the X at the top of where it says next slide, and that next slide should go away.
Yeah.
Up at the top.
It'll be in that.
Yeah, that should
Right
take
here?
it away. Uh-huh.
Okay. It's kind of covering. Okay, that didn't work.
Okay.
I'm sorry, I was thinking we could get a little bit larger. I believe you're in presenter view, so it's doing that.
Yeah.
But
You can, if you unclick use presenter view towards the right of your mouse.
Use presenter view.
Yep, just down
Just
from where your
below that.
mouse is now.
go down, down.
Go down.
Down.
Right
Yep,
there.
if you unclick that, and then if you go back to from current slide, that should allow you to,
There we go.
there you go.
All right, great. Okay, so you can see that on this chart that actually we are seeing that our numbers, our total numbers are increasing, and the rate of new cases are continue to increase, especially over the last week. So as of July 20th, which was day before yesterday, a total of 2,237 confirmed cases have been reported. We break them out by female. That includes 1,164 females, which is 52% of cases, and 1,073 males, which is 48% of the cases. Racial distribution, 47.3% or 1,058 are African American, 22.2% are white, and 29.1% or 650 are Hispanic. Our age is ranging from 38 years of age to 94 years of age. And we do release daily numbers. And what we're noticing is that our numbers of cases are getting younger. So as of day before yesterday, in the age range of 0 to 10, we currently have 113. So we're seeing babies as young as 2 months old that are being infected. Between the ages of 11 and 20, we have seen a significant increase, and our numbers are now 264. And then our highest range of age being affected, 21 to 30 years of age, we see 458 cases. So this is important because I think that when we initially, and we continue to say that people who are age 65 and older are most negative or can be most negatively affected by the virus. Again, I think that our and that is true. I think that some of the younger people thought they couldn't get it. So we're changing the way that we are educating now. Any age range can get the virus. And we expect that those people with who are healthy with no underlying medical conditions will recover with no problems. We're not so sure about that anymore. We're seeing people as young as 38, no underlying medical conditions. They have been on a ventilator for 8 weeks. They have thrown clots, have strokes, especially this one case, and had to have some amputations. So this virus is so unpredictable, and any age range, anybody is at risk for getting the virus. So we want to be sure that people understand that it is just not the elderly, it is any age range can have some very serious effects from it. Now here at the health department, we don't care for the patients, but we usually end up talking to I guess about 90% of the people who have been confirmed. 10% of that we have to get information from family members because those people are still hospitalized. A lot of them on ventilators that we can't talk to. But we also have a report of a nurse that some of us know, and 55 years old, no underlying medical conditions, and it was diagnosed with COVID and is now in physical therapy. It has been a couple of months since she has recovered from COVID, but she's now in physical therapy because of the extreme weakness that she's had from being in the bed for so long. So she still has a long road to go with being able to use her limbs. Her limbs just, especially on one side, she keeps saying, it just doesn't do what I need for it to do anymore. So she's in physical therapy. So we want our messages, we want the public to understand that just because you're in a certain age range, that may be the age range where it is not expected that you would have any problems. That is not the case. We're seeing more and more where we're having younger people who are healthy with some very serious, sometimes life-changing conditions. Okay, so far we have had 34 deaths, and most of our deaths have been in elderly people with underlying medical conditions. We have one death so far of a female patient who was 68 years old with no underlying medical conditions that anyone knows of, who passed away from the virus. This next chart is what's specifically important to us, and it actually shows that when we started getting cases and following these cases, you can see that at some point we were under a stay-at-home order, and I can't remember exactly when that order was issued, but you can see at some point that around Labor Day, right here, we were actually going down. We took a little bit of a dip, and then at Labor Day, things opened, partially opened. However, we think what the public heard was things are open. They didn't hear partially. And so they felt like the pandemic was over. And you can see from this point in June, actually right here is where we took a little bit of a dip. And we were excited about that because we had actually plateaued along here. The numbers were starting to come down. We were expecting a significant decrease. And then we partially opened, and you can see how we took a U-turn and how the numbers have continued to increase significantly. So we do what we believe we know that works is if people stay away from people, that works. The numbers show that once things were open, people weren't wearing masks and they weren't practicing social distancing, those numbers started to go up. And we're at a point now where they continue to go up. Any questions about that?
Those are numbers, right?
Yes.
Cases.
These are cases. These are actually numbers of people who have tested positive.
So what about the percentage of positive cases of all the ones that you test?
Okay, so what the issue that we have with that is that there's so many testing places now. We do not get reports of all of those negatives. We do get reports of the negatives from when we have military community testing coming in. We get those negatives. We don't get the negative reports because they're not required to be reported to us. Now, a lot of people think that that we should get all of those results, and you know, we're thinking about asking for those. We don't know. We know that would give us a percentage, but that is a lot. That is going to be a tremendous amount of effort on the part of the private testing companies, because we would only need those negatives for the people tested in Beaumont, and they test people all over. So we don't have an accurate percentage of total number tested versus the total number of positives. However, what we do know is that people who are testing positive are dying, and they're having serious side effects from this from this virus.
One more thing. What was the date that they made it testing available to anybody that wanted it? Initially,
you know, yeah, I really don't know. So when the airport was doing the testing, we, you know, they were doing some tests for anybody who showed up, and then they were doing some testing only for people who had symptoms. So initially there was a lack of testing capabilities as far as the swabs and the culture and the actual testing procedure that was limited. And so that's why testing started out for people who were symptomatic only. Then we went to a point where we found out that asymptomatic people were testing positive as well. So I don't know the answer to that question, because at some point everybody was able to get tested. There's still some companies that still do only test people who are symptomatic or who have been exposed. But we know that between 40 and 50% of positives are people who have never experienced any symptoms at all. We talk to them. Did you have a headache? Yeah, and they're surprised, because a lot of times when we call, that's the first time that they're hearing that they've tested positive. So they're like, I can't be positive. I'm not sick. I don't have any symptoms. And of course, that those are the people who are our major concern, because if they test positive on the test that's done, they're still infectious. So they can infect, a negative person can, with no symptoms, can infect an elderly parent or grandparent, and then that person can have some really serious side effects. Any more questions?
Ms. Ulmer, I have a question. With respect to, and I appreciate everything that you're doing for us. And as you said, we're learning something new every day. But if you look back in April, what was the average COVID stay in the hospital with the therapeutics that we had and with the understanding of treatment that we had then versus July or today? Average stay in the hospital.
So I don't know the average hospital stay back then in April. I do know that probably a month ago, we were real excited because we heard that the average hospital stay was about 11 days. And this was about a month or 6 weeks ago, that though patients were being hospitalized, they were having less severe symptoms and their hospital stays were less. However, in the past couple of weeks, that has changed again. So we're seeing those average number of hospital stays more than 11 days, and we're seeing people coming in with more severe illnesses, to the point where both of our hospitals at one point each hospital had 10 people on ventilators.
Ms. Ulmer, Robert Turner here.
Yes.
Question: when someone is test positive, is any advice been given to them of any over-the-counter drugs to take or what have you while they're self-quarantining, or
no?
Or are they just self-quarantining and hope that they get better, and if they get worse, go to the hospispital? What's the
and actually, and those are the instructions. That's the guidance by CDC. No, there's nothing they can take. Fever-reducing medications if they're running a fever. Over-the-counter medications, if they're congested, there are certain things that they can take. But no, the guidelines are, if they can manage their symptoms at home, manage the symptoms, stay home, manage those symptoms, and if they get worse, then yes, and there's a list of symptoms that if they get worse, that they should immediately call 911 and go to the hospital.
Yeah, what I'm saying is, when the person who calls them back and tell them they're positive, are they giving them that type of information?
Yes.
Okay.
Yes. Yes.
So when someone is positive, they aren't put on a medication immediately?
People who are at home, no.
So you got to get really,
those
really
patients
sick before you can get medicine?
Those patients who are ill enough to be in the hospital, I'm not sure what the treatment is in the hospital, but they try to get those patients on, I think there's an antiviral medication that they use, there's azithromycin that they use. Some doctors will start their patients on azithromycin if they start if they test positive and they are at home. There is no medication that they're starting on if they test positive.
You don't get treatment unless you're smart enough to go to the hospital. Is that what?
Yeah, some patients are being started on azithromycin if they test positive. That's not all patients. No, that is not all patients. The azithromycin does nothing for the virus. It actually helps to prevent any type of secondary bacterial infection. But typically, no, people are not started on medications if they test positive and they're not sick enough to be in the hospital.
Sherry, this is Beverly Hatcher.
Hi, Beverly.
I'm not sure if you can hear me.
I can.
Hello. Thank you so much for your wonderful your presentation has really startled me with the young people that have tested positive.
Mm-hmm.
I am one who has been of the opinion COVID-19 is more susceptible at an older age.
Mm-hmm.
I'm asking you, will our school system in Jefferson County look to you for guidance and understanding that this COVID does affect children?
Yes, we're working very closely with BISD, very closely with them. And so we just had a meeting with them last Monday, as a matter of fact, in preparation for them to start school. Initially, they were told that they needed to start school in person as well as online. Excuse me, for those parents who didn't want their children to go to school. Now I think that TEA is actually giving them a 4-week later start date with an additional 4 weeks according to how things are occurring in each one of the communities. So yes, we're working very closely with BISD. And the key, once school opens, and let me back up. I think our issue is with what we're dealing with now, just with COVID and the seriousness of the infection, along with the fact that public health has to contact each one of the persons who test positive. We have to get information from them. We have to do a case investigation. Sometimes we have over 100 cases a day. We have to contact each one of those persons, and we want to do it in a day. Sometimes we can't always do it. But then once we get that contact investigation, we need to know the onset of symptoms, whether or not they had symptoms, what were their symptoms, and their symptoms are different across the board. We've talked to 1,000 people, a couple thousand people. Symptoms are different across the board. And then there's 40 to 50% of people who don't have any symptoms at all. So we have to do that case investigation, and then we have to find out from that person, where have you been? Where have you been? We try to determine when that person was infectious, even though they were not symptomatic. On the day that they tested, if they tested positive, we always back up 48 hours. And then we give that date to the person. Let us know where you have been and who you have been around from this date forward, so that we can contact each one of those persons. And we have had persons who test positive that pretty much have self-isolated, and they're at home, they're not around anybody. It's like, I really don't have any contacts, I live alone, I haven't been anywhere. They may have none, they may have 1 or 2. Then we have those persons who really don't know where they've been. They can't tell us anything. And then we have those persons who we end up with 40, 50, 60 people as contacts because they've been, I went to a funeral and there were a couple hundred people there. So A contact is defined as a person who has been within 6 feet of a confirmed case for at least 10 minutes. So that's how we identify our contacts. So the more people move about and the more that they're around people, it makes our contact tracing sometimes almost impossible.
Sherry, this is Christine. I just wanted to say thank you. I know you've been dealing with this since the beginning, and I know how long you've been out there actively monitoring and handling the COVID-19 issue. So kudos to you and the Integrated Health Department. Thank you.
Thank you. Thank you, Christine. Christine has been another one of our very solid, good, professional colleagues. So yes, thank you. Thank you so much for that. I mean, in the beginning, we were like talking all the time in the beginning of this. Yes, yes, yes.
Hey, Sherry.
Yes.
This is Bernie Pierce. Hey, I was wondering, for those of us who've been blessed not to have the COVID new precautions, is there any type, I don't know, maybe wishful thinking, supplements that we may could take? So I'll make something dumb, like vitamin C or something that helps us more resilience, over-the-counter type drugs.
You know, there are things that we've heard about. We see nothing in the CDC guidance about it, but it certainly wouldn't hurt to take it. You know, I read about taking zinc and vitamin C, so I take it. It's not going to hurt you. It's not something that we promote, you know, publicly, but it's not going to hurt.
This is Alan Sampson, Sherry. Among those that are most, or which are showing up most prevalently as testing positive, is there anything as far as their exposures that it would indicate maybe a common pattern? Or is it all just random?
No, it is, you know, sometimes it is random, and then sometimes it's we can very definitely, we may not be able to pinpoint the person, but if it is a household contact, we can almost expect that household contact will convert to a positive. That's not always the case, which is a good thing, but that is a lot of times the case. Those people who live in the same house with someone who has tested positive, test positive. People who have been in large crowds, people who, again, like I said, they may have attended a funeral. Those are the people that, you know, we may not be able to pinpoint the person that they became, that they came in contact with, who may have exposed them to COVID. Because again, a lot of people are asymptomatic, which is why it is so important to avoid large crowds. And I was so excited when there was an order that masks were mandatory. We do know that the mask will work, even though it's not a hospital grade mask. If it's a face cloth, and if everybody wears one, we do know that will decrease the transmission of the virus. And we also want people to not just wear the mask, but to still practice social distancing, because these are not hospital grade masks. So sometimes it is hard to determine whether or not, to determine exactly where a person got the virus, but it's usually those people who are very active, that have a very active lifestyle, and that lifestyle has not changed since this pandemic. And that's one of the messages that we as public health officials across this nation, we're trying to get out is it's going to have to change. Your lifestyle is going to have to change. If you were very sociable, then we're not at a point now where we can continue to do that. There was a family in Dallas, I think earlier this month, and one family that had a party at one of the family members' homes. It was a fairly large party. Someone there had COVID. 18 family members ended up positive. 2 grandparents, and the grandfather at that time was at the point of needing a ventilator. So we want people to weigh the risk, and we know that people have to assume responsibility for themselves, but these are challenging, different, unprecedented times. And so we as officials, I think we should be saying it constantly. I'm hoping that at some point, some of the people who have actually had the virus are going to be able to tell their stories, because some of the stories are tragic, of young people, younger people with no underlying medical conditions who have life-changing challenges that they're going to face. So again, we need people to follow the public health techniques. We know at this point there is no vaccine, that if you do have the virus, the medications that you're given aren't specifically designed for this virus. This virus has, sometimes I think the virus is smarter than we are, but there is no specific medication that has been designed to treat this virus. There are medications that are being used, but it's not always successful. If your lungs fill up with fluid, then there's supportive care. You're put on a ventilator. If you have fever, you get Tylenol, but there is nothing specific designed for the treatment of COVID at this point. So what we do know that will work is tried and true public health techniques, and that is wash your hands, wear a mask, practice social distancing, stay home if you're sick. We're getting ready to enter into flu season. So that's going to add another layer of complications on top of this COVID that that could potentially overwhelm our healthcare system, which is already overwhelmed. So we need the public to understand and help fight this virus.
Hey, Sherry, I have a question. In the event someone tests positive, and they're asymptomatic and they self-isolate, does over 14 days, or is there a period of time where the virus will pass through or whatever, then to test again, they'll test negative, or what's the protocols once someone is?
So if someone tests positive, then they are instructed to stay home. Initially, it was 14 days. CDC has recently changed that guidance just this past weekend. So the time that we're looking at now is a person who tests positive not only quarantines, but they should isolate themselves at home. If at all possible, isolate themselves from the rest of their families for at least 10 days. They need to be fever-free for at least 24 hours of those 10 days, the last 24 hours of those 10 days, without taking any fever-reducing medication. And retesting is no longer recommended by CDC before you can be released to go back to work or go back to your normal activities.
Jerry, the questions are great, but did you have more of your presentation you wanted to?
Yeah, so thank you for your questions, though. They always appreciate those. So you can see this bottom chart is COVID cases by zip codes. So you may not be able to see this, so I'll go over it with you. So we have 77705 right here with the highest number of cases, followed by 77706, and followed by 07 and 08. over here is 77703 and 77701. So it is spread out across all zip codes. It is community spread. So we need everyone to practice good, solid public health techniques.
Ms. Sherry, can I ask you a quick question? My name is Tish.
Tish.
I have several family members right now that are dealing with COVID from different age ranges. And one of them is an uncle of mine that actually had it back in April, fully recovered. He lives in Harris County, but he now has it again. And this time his wife has it also. Have you seen a lot of patients that have had a reoccurrence?
No, we
whenever
haven't.
you're doing your numbers? Okay.
No, we haven't. We have seen people who it has taken longer than initially the first 14 days. When we were on the 14-day guidance, we've seen people who it has taken longer to recuperate, but we have not seen people test again positive.
Okay.
So, but from what we understand in Houston, and I don't know how this is possible, but apparently they have a strain that's more contagious there. Have y'all read that?
Like I know in his case, he had it in April. He was exposed at work. He's a salesman. He does like ATV sales, and he was fully recovered. And then back at work, you know, someone else was exposed. And so it's kind of like they just keep passing it around. But he's the only one that he works with that has had it now for a second time. The first time my aunt was able to not get it, but this time she has it as well. She couldn't even smell Clorox, so she knew that that was an indicator that it's probably going to be positive. So, and they were.
Yes, that's the indicator. That's really, if you lose your smell, lose your taste, we're like, oh, you need to go get tested.
Yes.
You need to go get tested. That has proven to be 100% across the board with any of the people that we have dealt with.
And his first time he didn't run any fever. This time he's on day 10 of fever.
Oh my.
So
is he at home?
He's at home, yes.
Okay. Yeah. Now, you know, we've not had any instances here where people have retested positive after being negative. We have some that have continued to test positive for several months now, and then they finally would get a negative. But and again, some of those have been asymptomatic.
Okay.
So yeah, it's real difficult to predict this virus. It changes, and it seems to change person to person. We have a lot of different people with a lot of different stories. Some of them are similar, and then some of them are different.
Thank you.
You're welcome. So I know people have heard about the antibody test, and people are wanting to get tested for antibodies, but from the medical experts, we understand that even if you have antibodies, it is not clear whether or not you can get infected again at this point. Okay, any other questions? That's the last of my of the data. This last slide is about if you know of anybody who has had it, recovered, or who has lived in a house with someone who has had it, please encourage them to give their plasma. We know that Baptist Hospital is doing plasma transfusions for those patients who are critically ill, and they're trying to get that plasma in them as quickly as possible. Start that treatment, that plasma treatment, as quickly as possible. So if you know of anybody who's had it or has lived in a house with someone who's had it, please refer them to Baptist Hospital. And that number is 212-5979. And there's a nurse there who will walk them through the process.
Sherry, as of today, we have transfused 190 units. So, and it takes about 4 days off of a hospital stay. So it is definitely life-saving.
It is life-saving. So please, we have partnered with Baptist Hospital, and so we know that it works, and so we encourage everybody to let your family members know about it. Anybody that you know, please let them know about it. It does work, and we believe in it. Thank you, Mary. Thank you for that.
Sherry, I had a question about the race and ethnicity makeup of the data. Is there anything, I know nationwide, we're hearing about, the impact on the Black and brown communities, and with the data it even looks at, I kind of got a little shook when I saw 77705. I'm sitting right in the middle of.
Well, I'm right next to you in 06, and we have just as many. We have just as many, yes.
So is there anything that we need to know in terms of what that translates for us? Is it more people are testing? We need to do more testing in those areas. What do you suggest?
Yes, I do believe that we need to do more testing in these areas. We've worked with the military who's come out, and we have tried to place them across the city in all zip codes. And we are having 300 and 400 people, and that's only one day. In one day, we're having 300 and 400 people who test. So the need is there for people to be tested. And we have really found that if we do a certain amount of testing, we see 10 to 15% of those tests that we do are going to be positive. So,
which is high.
Which is high. If we do 300, 15% is 45 people. Well, that's 45 people who have been out, and they have already been exposing other people.
Right.
So yes, we certainly need testing. We need ongoing testing available across the city. We do have a lot of private places that test, but the military, when they come out, they'll come out and do it at no charge. They do walk-up clinics. There's no registration. People just show up and get tested. We need to encourage people, and we're working with everybody now, all the private clinics. Once a person tests, that person needs to stay home until their test results come in.
I've got one more question, if you don't mind. It's something that you always see people questioning about it, and so don't think I'm just trying to stir the pot, but this is something that I've heard a lot about. The homeless population. Do you have, yes. I mean, do you hear about them? Probably the least sanitary population we have, and they live just, right under each other's noses, unfortunately, but
right.
People.
So the CDC guidance right now on the sanitary population, on the homeless population is to leave them alone, leave them where they are. And we've not, that from my knowledge, I don't know that we've tested anybody who's homeless who's ended up positive. So
but if they got really sick, they would be transported to a hospital, and
yes, exactly. So, but that's the guidance, is to leave them where they are. Do not try to disrupt their campsites at this point. And so far, we've not had any problems from that, from that population.
Jerry, this is Angela Baker. And
hi, Angela.
I miss seeing you. I have a question. You keep repeating it over and over, that we need to stay out of crowds. We need to stay away from people. Is this virus going to go away if people don't stop doing that? And I'll give you an example in my own neighborhood. On July 4th, one of my neighbors had a party that there were 50 or 60 people outside. There were no masks. There was no social distancing. It went on way into the night. If people don't stop doing this, is this virus ever going to go away?
It's certainly going to be difficult for it to go away. This is what I heard a doctor say a few weeks ago, and I use it often. I used it at council yesterday. This virus is an unthinking parasite, but it is doing what it has been designed to do, from whatever origin. We understand that it came from a bat in Wuhan. We understand that, but it is doing what it is designed to do. It needs a host, however, to continue to survive. And if we, the thinking humans, will continue to provide that host, we're going to see it for a while until we can come up with a vaccine or come up with a medication, some type of treatment that's designed to treat this virus. So all we have to work with is those public health techniques that we keep talking about, and large crowds, not wearing masks. Those are the things that are going to continue to allow this virus to live and to thrive. So yes, we have to be responsible for outsmarting the virus. Right now, I think we're kind of at the virus, we're at the mercy of this virus. And so we're going to have to use the knowledge that we have. And again, we as public health officials and our politicians, we have to agree and speak with the same voice so that people will understand. We have to model for people. When I go out, even before the mask mandate, when I'm out of my office or out of my home, if I have to go to the store, I wear a mask. And so I was so glad when the mandate was issued, because now you have to, a lot of businesses won't let you in, but people are still having problems with people walking into their businesses and not wearing masks. So it's just always an issue. But if we just all came together and did what we know works, then I think that we would at least have a better chance than we have right now.
Okay, we're running out of time. I know Virtue Alexander wants to ask a question, so let's take your question, Virtue, as the last one, and then we'll close out.
Okay, thank you. Hi, Sherry. Thank you so much for your presentation. My question was in regards to the kids. I know you mentioned, that babies are being diagnosed anywhere from 2 months to 10 years old. And I know that there's not necessarily a mandate for the little ones to wear masks, but what are their symptoms like? Is it pretty much the same? And because they're so little, they can't really tell us if they can't smell or can't taste. So I was just wondering, how is that? How are they're being tested?
A lot of them are being tested because someone in the household has tested positive. A lot of them are symptomatic or asymptomatic. A lot of them, however, have congestion. Your parents think that it's a cold. Oh, they have a cold. So we're not seeing serious symptoms in those that are younger. However, we do know that there is a syndrome that children in other states who have had COVID have experienced. And so we still want to be careful with the spread of the disease. Though we have not had a baby with very serious symptoms, we certainly want to keep it that way.
Right. Thank you.
Sherry, I want to thank you, Sherry, for this has been so informative. I have taken a page full of notes today, and I appreciate you clearing up a lot of things. And the question and answer throughout the presentation was so helpful to me. So thank you so much for joining us today and sharing your knowledge about the community and about this baffling virus that we have right now that we're just all trying to figure out.
Exactly.
In your honor, we're going to make a donation to the Rotary Foundation in your name, and it's going to go to the area of disease prevention and treatment.
Oh, thank you.
We thank you so much for sharing your wisdom with us today. Our next speaker is going to be Ashley Thomas, an attorney with Littler Mendelson PC of Houston, speaking on the impact of COVID on HR policies and responsibilities. And a reminder that we have a Board of Directors meeting next Tuesday at 11:30 via Zoom. If you want to join us, get in touch with Jackie and she will send you the link for that. In closing, I want to thank you for attending the meeting today. And we're going to end with the 4-way test. First, is it the truth?
It's the truth.
Second, is it fair to all concerned?
Is it fair to all concerned?
Third,
Will it build
Will it build goodwill and better friendships?
And fourth, will it be
Will it be
beneficial
to all concerned?
Have a good week. Go out, practice these safe practices that Ms. Ulmer has given us today, and let's try to nip this virus in the bud. Have a good week.
Bye, everybody.
Bye.
Good week. Thank you.
Thank you so much.
Thank you.
Sherry. Bye.
Thanks, Sherry.
Thank you. Talk to you later. Bye-bye.
Bye.